So in short, the Tygerberg Hospital Children's Trust supports the child patients of Tygerberg Hospital. Tygerberg Hospital, of course, being the biggest hospital in the Western Cape. So our trust looks at our role quite holistically, since we are not a children's hospital, which means we can look at the ecosystem around the child patient, which includes the mom, the families, communities, education, which includes the Tygerberg Hospital School, Stellenbosch University, and of course businesses in the area that support the ecosystem. Well, you know, a charity is a social business, so relationships are important. It's been very strange not being able to connect with people physically, but we are very, very thankful for being able to use digital tools. Of course, as a trust, we are needs-based, so we follow the needs of the hospital and try to address them as best we can. Not being physically there is also challenging in terms of understanding those needs so we can properly address them. So like I said, we are needs driven. We also had the opportunity to look at countries that were ahead of the pandemic, such as those in Europe and in Asia. And we saw that PPE was going to be an issue that needs to be addressed, particularly with the medical workers. The Trust has already made significant contributions to the hospital in terms of masks, infrared thermometers, and medical grade visors. Beyond that, we are also helping on a big scale with our partners such as the GTP, the production and delivery in mass of fabric face masks. This not only for the hospital workers, but also for our child patients, their moms and families that come and visit. So those are things that we are addressing right now. So I think two things are important. Number one is the importance of technology and digital tools and how this can help us. The next thing is the importance of social connection and social cohesion. So both of these things have always been available to us, but through this pandemic it's highlighted the importance of those two tools going forward. And for us as community of people, what is the new norm going forward? I think these two things are going to be the most important to consider. So we've been massively disrupted by this pandemic. By example, our organization spent the better part of January designing strategies, events for the year ahead. As soon as we were hit by the pandemic, everything changed. We had to shelve all of those and look at now different ways of raising funds and looking at how we can address the needs of the hospital in a completely different way. I think South Africa is a segmented country on all levels. I think what this pandemic has shown us is that for us to succeed as a nation, we need to stick together. I mentioned social connections and social cohesion as vitally important to the way we move forward as a society. So for the Bellville community, I'd like us to all to consider how to work together going forward, and we can build a better Bellville, a better Cape Town, a better South Africa, and in fact a better world through this. The Tygerberg Hospital Children's Trust is an NPO and public benefit organization. We exist entirely by the grace of our donors. In the short term, we are addressing very dire needs at the hospital. The need for PPE, as I mentioned. Also our volunteering initiatives, we need people to join that and help us be able to deploy volunteers when needed in our communities. Those are needs that are happening right now. As we progress through this period, we're finding more and different challenges coming to the fore. For example, our KMC moms at the hospital are stuck there because of restrictions of movement. So they run out of toiletries, they run out of clothes for themselves and for their babies. They need machines to wash their laundry. So those are some kind of practical challenges happening right now. And we urge the community out there and those who want to help us to join us in the battle to help fight against those challenges and address those. In the medium term and the long term, we have lots of challenges beyond COVID. Tygerberg Hospital has some of the highest rates of tuberculosis in the youth in the world. Those are existing diseases that don't just go away. There are many other challenges like HIV, education, malnutrition in our communities that we also have to address. These things have been there all along. So in terms of going forward, I really encourage businesses, individuals who want to work with us and make a difference to join our organization in this fight.